We're talking about choking, a very important topic for parents in particular of toddlers and infants, and we're talking about it with Dr. Nancy Tofil, Division Director of the Division of Pediatric Critical Care here at Children's of Alabama. Thanks so much for your time.
You're welcome.
And you're also the Director of the Pediatric Simulation Center here at Children's of Alabama. That's where we are now, and you can see we're going to do some demonstrations in just a little while of the Heimlich maneuver and things that you can do if you happen to be in a situation where your child is choking. But we want to go into some background information first, Dr. Tofil. Stats on choking in children. What can you tell us about how common this is?
So choking is certainly one of the more common causes of unintentional injury or fatality among children. Choking is most common for children under the age of 3 or elderly folks over the age of 75 to 80. Common causes of foods or objects that get choked on include peanuts, popcorn, hot dogs. Grapes are also important, and that's why those are so important to cut up properly. If you think about a child, their airway is the size of their pinky.
Wow.
So it is much smaller than our pinky and our airway, which makes them that much more likely to choke. Apparently, my father tells me that I choked and almost died on a cherry pit, and he actually had to do the Heimlich maneuver on me when I was a child.
So this is a topic for you that's kind of close to your heart in a way, I guess.
Yes, I don't recall this at all, but I'm alive to tell you the story.
Yes, and we're thankful that you are to pass along this great information. And you were talking about the pinky finger there. I guess that just underscores that regardless of what a child is eating, you need to make sure you're cutting it up into really small pieces, right?
Correct, especially when that object, either the toy or the food, is hard, because those are going to be objects that are more difficult to chew. In one study, they showed that peanuts was one of the most common foods actually choked on.
So I know that a lot of people have probably seen certain devices on social media that are designed to help if your child is choking. Can you talk about those devices at all? What do you know about how effective they can be and whether or not a parent should consider using those?
Yeah, so those devices have been available since about 2015. And there was an analysis of their effectiveness in 2020. And with that analysis, right now we don't have enough evidence to either support or not support those. But I think the key important thing is preventing choking, and if your child chokes, making sure we do the proper Heimlich, call 911, etc.
So very important to know the Heimlich, and that's what we're going to demonstrate right now. There are different procedures for infants versus toddlers and older kids. Let's start with infants. If you have an infant who is choking, what should you do?
So this is our infant simulator intended to simulate probably a 4 to 8 month old. So anyone under the age of 1, what you want to do is alternate back blows with chest thrusts. Okay? And I'm going to demonstrate here. And oftentimes the child is in distress, so they may have blueness around their lips, they may be less conscious than normal. So this isn't an extreme situation. You want to be aggressive because you've got to get that object out of their airway for them to be able to breathe.
Right.
And so what you're going to do is you're going to do 5 back blows. You want to make sure the head is below the pelvis here, so things go down, you use gravity, and you're going to hit 5 times, and then we're going to flip over, and I'll demonstrate at this point.
All right.
1, 2, 3, 4, 5. And if the child has not expelled the foreign object at this point, we're going to turn and do 5 chest thrusts. 1, 2, 3, 4, 5.
Okay.
And then again, flip over and repeat the maneuver.
Until it comes out, hopefully.
Until it comes out. If you have an additional provider there or parent with you or an older child, have them call 911 at the time you're doing this.
Right, yeah.
If it's just you at home, try this a few times, see if you can get it out, and especially if your child becomes unconscious, you do need to call 911 for help.
I noticed when you were on the backside, I mean, you're really hitting it pretty hard there, so don't hold back if you're in the situation.
You've got to get the object out.
Yeah. How about on the front side when you're doing the chest compressions? Is there a specific place that you're looking for?
What you want to do is you can feel, this is the xiphoid process. It's a small triangular bone at the bottom of the chest. You want to be above that on your child, because what you're trying to do is use the air in the lungs to create force to move that object out of the mouth.
Okay.
what you don't want to do is if you see the object in the mouth, you don't want to stick your finger in there blindly because you're more likely to move the object back deeper and cause more trouble than if you just proceed with your back blows, chest thrusts.
Okay, so that's a look at what to do if you have an infant and the infant is choking, but the procedure for a toddler is a little bit different.
Yep. So the procedure for the toddler is very similar to what we would do on an adult who's choking. And what we're going to do with this is the traditional Heimlich maneuver, which you may have learned previously in middle or high school or first aid class. And what you want to do on this size child is, again, you're going to find that xiphoid process right at the bottom of the rib cage. You're going to go right below it with your dominant hand. So for me, that's my left hand. And then come behind the child and thrust in and up. And again, trying to use the air in the lungs to push that object out. And so you're going to do 5, again, very aggressive maneuvers to try to get that object out. And then again, you can do the back thrust to try to get the object out.
And same idea, really, really firm.
And then if it's more of an adult like yourself, you're going to have the adult lean over and try to do the back thrust this way.
So you start with the back thrust?
After you do the Heimlich. So you do 5 Heimlich, and then really, because I can't pick you up like I can pick up this child.
Okay. And it's the same concept, I guess, you know, using gravity to your advantage in that situation.
Correct. And God forbid you choke and you're by yourself, you can actually use the corner of a table for your almost your self-Heimlich maneuver if you have to.
Gotcha. When you talk about, you know, let's say a child, you know, you're able to get the food up and everything's okay, should they still go to the emergency room at that point to get checked out?
I think it really depends on the child. If they get back to playing, completely normal, breathing comfortably, no distress whatsoever, it's probably okay. I'm pretty sure my father did not take me to the emergency room when I choked on the cherry pit. However, if there was any loss of consciousness, significant blueness around the lips, any question at all, especially you've already called 911 if this is severe, then I think I would let the professionals look at them.
Sounds good. All right, very important advice from Dr. Nancy Tofil here at Children's of Alabama. Choking, sort of certainly a front of mind topic for parents of toddlers and infants, and these are the procedures that you can use if you find yourself in that situation. For more information, go to childrensal.org.